Hello everyone, I am Dr. Abhilash, MBBS, MD, DNB, Internal Medicine, Consultant Physician at Suyog Hospital, Mysore. Today I will be briefly talking on thyroid disorders. Firstly, hypothyroidism. Hypothyroidism means there is a reduced production of thyroid hormone from the thyroid gland. What are the causes for hypothyroidism? Most common cause is Hashimoto's thyroiditis, which is autoimmune destruction of the thyroid gland, which results in reduced production of thyroid hormones. What are the symptoms of thyroid disease? Hypothyroidism causes weight gain, loss of hair, slowing of activities, mental illnesses such as depression, increased weight gain, reduced metabolism. There is swelling of lower limbs, there is swelling of face, swelling of upper limbs, there is menstrual irregularities such as occurrence of menses for 2 or 3 months or increased menstrual bleed. Such things are common in thyroid disorders, predominantly hypothyroidism. Coming to investigations of thyroid disease, hypothyroidism is diagnosed by blood investigations, which includes TSH, free T3 and T4 levels. TSH is usually high in patients with hypothyroidism. T3 and T4 are low in patients with hypothyroidism. TSH, if it is more than 10, it is indicative of hypothyroidism and it should be treated with thyroxine. If free T3 and T4 are low, that is also suggestive of hypothyroidism and it should be treated with thyroxine. Coming to treatment, there are no dietary changes which will cure thyroid disease. It is predominantly destruction of thyroid gland, so thyroid hormone should be replaced. Usually, thyroxine tablet is initiated at different doses, which is based on the symptoms and TSH levels and patient's weight. It is usually 50 micrograms, 70 micrograms or 100 micrograms of different doses, which should be taken once in the morning in an empty stomach. Other than initiation of tablets, patient should be with continuous follow-up. TSH should be tested every 3 months once, and it should be maintained below the levels of normal, which is usually 0.5 to 5, in the range of 0.5 to 5. Every 3 months, patient's TSH should be tested and patient should be on regular follow-up. Coming to the other spectrum of the disorder, which is hyperthyroidism, which is there is increased secretion of thyroid hormone. Most common cause is Graves' disease. It is also an autoimmune disease which results in increased production of the thyroid hormone. How it is diagnosed? What are the symptoms of hyperthyroidism is? As in hypothyroidism there is weight gain, in hyperthyroidism there is weight loss. There is excessive appetite. There is also lower limbs swelling, upper limbs swelling, clubbing, and there is increased menstrual irregularities. Excessive agitation, psychosis, depression are also seen in patients with hypothyroidism. Coming to treatment of hyperthyroidism, first patients diagnosed hypothyroidism based on blood investigations. Blood investigation shows TSH levels very low and T3 and T4 very high. When TSH is low, patient should be treated on drugs such as carbimazole or methimazole. It is usually initiated at 5 mg or 10 mg per day, 3 times per day. It is usually taken after the food. Again, patient should be on follow-up with TSH every 3 months once. TSH level should be between the levels of 0.5 to 5. Clinically, patient should be monitored for weight gain, reduced appetite, and other features and other disturbances such as menstrual irregularities. Patient should be with continuous follow-up for every 3 months with TSH levels. Thank you.